Hey everybody, Doc Parsley here. First of all, I would like to open this COVID section with a clarification of words. Words matter. Words matter a lot. Words engage psychology and imply meaning. Obviously, that's why we use them. So we are not in quarantine. Quarantine means that you are sick and you are isolating or being isolated. You're isolating yourself or being isolated so that you do not infect someone else. So if you're not sick, if you aren't currently sick, you aren't quarantining. What do we call it when you have to stay home? And if you leave without approval from authorities, then you get in trouble. That's illegal. We call that house arrest. So we are under house arrest. I'm not saying that to stir the pot. I'm saying that to make this as uncomfortable as I believe it should be. We need to apply the right words to these. If we use euphemisms, if we say that people succumbed to the illness, it's a lot different than saying people died from the illness. Let's be adults and let's be realistic. We are under house arrest. There is a threat of going to jail. There's a threat of a fine if you leave your house for unapproved reasons in a lot of places, or if you leave without a mask, or either or both of those. If you go to unapproved places, these are things that you aren't allowed to do. That's illegal. That means that you're breaking a law by going outside of your house and doing things you aren't allowed to do. That makes it house arrest. You are sequestered. You are being locked into your certain region, however that goes. So I won't belabor that. Let me go to a screen share here and we'll start with what we always start with. Get that out of the way. So we always start over here, and I have nothing to do with this advertisement over here, but we always start with Worldometers info. So 2.2 million coronavirus cases. Not true. 2.2 million people have tested positive that we know of worldwide. Of that 2.2 million people, 500,000 people of those people have already recovered, meaning that we have currently 1.5 million cases. But of course, they love to talk about this number, 2.2 million. The headlines, the cases of COVID worldwide soar past 2 million. Daunting numbers. All right. It's 1.5 million active cases. 500,000 people have recovered. 150,000 people roughly have died. So that's what, that would be 1, 2, so I digress. 1.5 million active cases, 150,000 deaths worldwide. That's not very much. Let's go to this real quick. World population. Deaths this year, 7.3 million people have died worldwide. 150,000 of those have been COVID-19 related. Let's do quick math there because my brain is just not working very well this morning. 150,000 divided by 17. I'll just say 17 million. 17 and some change, but we'll do that. Is a 0.8%, meaning 99.2% of all people who have died since January 1st did not die from COVID, regardless of how you account for that. And I won't get into that mess, but that is a mess. If there's no agenda, then there's no reason to be changing the way that we are counting these. If we're counting these in a way we've never counted anything before, then we really need to be explained to why. I need to know why we're doing that. Otherwise, I'm going to assume a nefarious intent, just like everyone else. But let's get back to the cases here. Total number of cases, 1.5 million worldwide. Worldwide, 4% are serious or critical. 4% are serious or critical. So just like 2.2 million doesn't mean that's how many people, or even 1.5 million doesn't mean that's how many people have this disease. Of course, a lot more people have it than that. Probably at least one order of magnitude, if not a couple of orders of magnitude different. And 1.456 of those are mild, meaning they don't need medical attention. They just go home, drink fluids and whatever. So 4% of them actually need to be hospitalized as a serious or critical. Might not even be hospitalized, but let's just give the benefit of the doubt, say hospitalized. Hospitalized people may die. 20% of them may die. So 20% of this 4%, that are the number of people that are at risk of dying. This is what we're talking about. I'll get to this in a minute more over here. We're talking about deaths. I don't care how many new cases they are, because I could double, triple, quadruple. Like I said, I could take it up order of magnitude. We could have 10 times more people, most likely 100 times, if not 1,000 times more people, if we tested everyone in the world at once. So the total number of cases are completely irrelevant. I'll give you a number that's a little more relevant here in a second. And the numbers that are much more relevant are the total number of serious cases worldwide, 56,000, and the total number of deaths, regardless of how you correct them. We know that we are being advised to collect these in the most liberal fashion to give everyone the credit of dying from COVID-19, if it is possible that they were affected by this. To give an example, New York City had almost 3,800 cases, 3,773 or something. They added of people who had died at home or outside of hospital care and have never been tested, but because they didn't get medical care, we're assuming that their COVID was associated with, or their death was associated with COVID because they would have gotten medical care otherwise, right? Of course, they didn't get to the hospital in time because of COVID-19, or maybe they had COVID-19 at home and nobody ever diagnosed them, and therefore they died at home and didn't get tested. So let's give that the benefit of the doubt. Of course, there's another reason I can think of that a lot of people are dying at home right now. Anybody help me out here? Possibly because everybody is locked in their homes right now, and people are afraid to go out. People are afraid of the virus, and people are afraid to go to hospitals because they're war zones. So I'm not saying it's not bad. It could very well be bad, but let's not compare that to a war zone. That is disrespectful. All right, total number of cases, total deaths. It can only go up. It's just total, right? There's no ratio there. So we look at right now, total deaths in America, total deaths, new deaths worldwide. China's put up a big number again, from 0 to a big number. So yesterday, what did China do? Yesterday, China had no new deaths, and today China has 1,300 new deaths. So who knows what's coming out of China? Can't really count those because their data is not great. 685,000. If I do my math correctly, we are looking at 1/3 of all the cases worldwide are being recorded in America right now. Wow, we have a lot of this. No, we don't. We're testing a lot, regardless of what the media wants to say about how poorly we are doing testing everybody, or how late we got started. We are testing way more people than everybody else. We have tested 3.5 million people. If you looked at that, nobody is comparing to that right now. Nobody is comparing to that. And you say, oh, well, their population isn't anywhere near as big. You know what? I did some math on this yesterday, and that's another insincere little game people want to play there. If you look at the test number of tests per million in population, you have these huge numbers here, right? These people are testing 120,000 out of every million people. How is that possible? Because their population is 50,000 people. Iceland's population is 340,000 people. We have 340 million in America. So let's break this down, get it down into realistic numbers. The population of Sweden. Sweden has a great number, whereas, let's see, Switzerland and Sweden. Switzerland has 8.6 million people. That's how many people we have in New York City, okay? So I realize I'm arguing both sides of the argument here, but not everybody in America is currently at risk. If you look at the hot zones, the number of people in the hot zones that need to be tested, because things are critical, we're having a lot of serious cases and we're having a lot of deaths, we need to hyper-focus on those areas. We are doing really well. We are testing a lot of people. Let's get back to it. Oh man, I hate it when it does that. And I don't know if I can fix it. Okay, that's messy. If we, again, total deaths, this was yesterday. That's a big number. America threw up a big number. We seem to have plateaued at around 2,000. This is the other number I wanted to point out. Serious critical cases, 13,369. Remember what I told you up here? Oh man, that's such a mess. But only 4% of these cases are serious or critical, and a possible 20% of those would die. So if 20% of all serious cases die, like, we are going to have a hard time putting up more than 2,000 people per day. That's just not a super realistic number. So total serious cases are what matters, right? The other 96% of people are going to be just fine. We only really care about deaths. All right, so let's talk about a headline, because I love the headlines. The headlines are deliberately engineered to create fear. I don't care which paper or which news source. I've not seen an exception to this, and I've read a lot of news about this. New statistic reveals why America's COVID-19 numbers are flat. Okay, basically the argument that this, what is he? He's an epidemiologist, an infectious disease professor at Stanford. He has said that there's something called a test positive rate. So when we test people, say like we test people for the flu in America, that means right now, if we're not having a flu epidemic, that probably means that somebody feels like they feel really bad and they go see their doctor, and the doctor tests them, and a certain number of those people will be positive and a certain number of those people will be negative. Well, if you have a lot of a disease around, then you would expect more people would be positive, right? Because it's more common that they're coming to see you for this bad disease. Okay, so with me so far? So if you test 100 people and only one of them actually come back with the flu, you go, wow, the flu is really not what's causing all of these problems. It's only 1 out of 100 people that have come to see me feeling really bad that actually have the flu. Conversely, if 50 people come, you go like, man, the flu is a big issue here. The other 50 people made up of all sorts of reasons, but 50 out of 100 people who came to see me about having a flu actually had the flu. There's a lot of flu going around. So his argument was, because we have a really high positive number, like 20 to 25% since this has all started, that means we are facing a really bad pandemic, because there's a lot of COVID going around. One wrong answer, Stanford professor. That is not the truth. We are only caring about deaths right now. We do not really care that people are going to get sick. And I don't mean that as that to be dismissive as it doesn't matter and we're callous, saying we're shutting down the economy, we're changing our way of life, we're impacting the global economy, we're impacting our well-being, we're risking suicides, death, all sorts of consequences to our current actions. And we are doing this to avoid deaths, not to avoid illness. So let's be honest, we're trying to minimize the death toll. Well, if only 4% of all the people that we're currently testing are coming into the hospital, and there's a lot more of this disease going around than we are aware of, then that's not even 4%, is it? It's not even 1%. If we're going orders of magnitude, the death rate could go from the current estimation of 0.3 down to 0.03, 0.003, 0.03, by the way. That's lower than the seasonal flu. So it's not true that just because we're testing a lot of people and a lot of people are having it, that we're in a worse pandemic. In fact, it means we're in a better pandemic. We're in a better pandemic because not nearly as many people are dying from this as we expected, which means it's nowhere near as deadly, which means that we can risk more people getting it, which means we can go back to work sooner. All right, enough of that. So let's talk about another thing that's happened big and bold all over the country. I tried to go to a drugstore yesterday to buy some deodorant and dental floss. And when I walked in, they said, you need to have a mask there. I said, well, I don't have a mask. I'm just grabbing this right here and I'm going to check out. And they wouldn't allow me to check out. They wouldn't allow me to buy anything. So I had to go out to my car and I had to get a bandana and I had to wrap a bandana around my head. And I wrapped a bandana around my head, and then I was safe. Then I was in compliance with Austin City rules, laws, as they're calling them. I don't think they're laws yet. But we now have these executive orders that say you can't wear a mask and you can't leave your house and not wear a mask in Austin unless you're in your car, you're exercising, you have a medical condition that makes wearing a mask for you uncomfortable, or you're experiencing homelessness. Now, my argument is once I'm outside of my house, I'm homeless, right? So we're all experiencing homelessness. So this is upsetting to me. I understand going into stores. If I go into a store and somebody owns the store, they can say, hey, man, you got to take your shoes off at the door, or you can't use my store. And I'd go, all right, I'm not going to use your store. I'll go to another store that's your competitor. But right now, everybody has to say you can't be in my store without a mask. All right, fine. I'm not blaming the stores. But the fact that they're saying, well, you have to, if you're walking down my street, I'm outside and I have to wear a mask. Now let's talk about what a mask actually does, right? So if we go to community mitigations here, PubMed, this is NIH government, this is like the research that we value the most, makes it to this site. And if you look at the community mitigation guidelines to prevent pandemic influenza, and I know this isn't influenza, but this is our model for pandemics. And so 2017, that's well after H1N1, it's well after the swine flu, and it's well before COVID. And what were they saying? Well, basically what they said here is that these are all the things you've already heard. We're trying to create this, right? So this is what happens if we don't do anything and just allow everybody to get it. Then these are all the total number of cases. Now, this could be going on. We could have had a lot of people been infected. But if we want to switch this x-axis or this y-axis instead of number of cases, we want to fix it. We want to set that to how many deaths are we having? Well, we're trying to make this not happen and make this happen. Thereby, if this is flatter, the total number of people under here should be less, because at some point we overwhelm our medical ability to help people anymore, and people who would have otherwise lived end up dying. And so we're killing an excess, unnecessary number of people are dying. That's what we're trying to prevent. That's what flattening the curve is all about. I think you all know that, but I have to cover things. And here's how we talk about what do we do to mitigate, like what requires mitigation. So if you look over here on the x-axis, the severity, how severe is this disease? Is it really severe? Does it cause really, really bad symptoms, illness, and death? That would be really high. If it doesn't really matter, it's really low. How transmissible is it? How easy is it to give to somebody else? Well, that can be super high. It can be really easy to give to somebody else. It could be really hard to give to somebody else. So obviously the worst quadrant would be very severe disease, very easy to give it to other people. Right. So let's give some examples of that. What is that example? I didn't want to do that. Let's go back. Just do this. All right. So here is H1N1. It was pretty transmissible, pretty easy to give it to other people, right? That's high up. How severe was it? Only moderately severe. All right, there's a 68 pandemic and a 57 pandemic. These are very, very deadly. ironically, they weren't super severe, but they were very easy to give to other people. And then, of course, we have the Spanish flu of 1918, which was both really severe and really easy to give to other people. That was a transmissible, high transmissibility. So we have decided that obviously we think this is going to be way over here. We think this is very severe. We think it's killing a lot of people. My bet is that it actually ends up low over here, that it doesn't really kill a lot of people. But right now we're assuming that it's very severe, kills a lot of people. So it's way over here, not way over here. Sorry, I misspoke there. And that is super easy to give because it's airborne. It's airborne, not aerosolized. Aerosolized means that it's in the particles that we sneeze and cough. Aerosolized means that it's actually airborne means that it's actually floating as its own little virus out in the world. You breathe it out, it's in your breath, and it's just floating around there. It doesn't need a water particle. It's like a dust particle, and it floats around based on how much wind and how hot it is, and what else is in there, what's bringing it down, what's colliding with it. A billion variables go into how long is it going to stay floating around. We don't know, but we're thinking, well, it's going to float around. That's a really dangerous thing. So we should wear masks. All right, let's talk about masks. So I'm not telling you not to wear a mask. I'm just pointing out that walking around and seeing everybody in a mask is very disconcerting, right? That is not a normal state of affairs. That leads to people feeling as though the world is a very dangerous place. So dangerous you have to wear a mask. Ironically, people who wore masks used to be dangerous people. People who wore masks, loners, those were dangerous people. Now, if you want to be a safe person, wear a mask and stay away from everybody else. The world's gone crazy. All right, so let's look at research on masks. So I thought this was interesting because this is the community psychology during the H1N1 swine flu, that they did some research in Hong Kong. And again, all the research, everything we know about coronavirus right now is wrong. We haven't known about it long enough to understand it very well. So the way these pandemics play out is hindsight. After we get a couple of years down the road, we've got a lot more data and we can understand a lot more. We're doing a lot more research, and we can make more intelligent comments and policy around it. So this paper was produced in 2010. So this is a year or so after. They've collected some data. And what they did is they randomly chose people in Hong Kong just to see how did they feel about H1N1 when it started. A little further down the road, like how dangerous did you feel? How afraid of it were you? How much did it disrupt your life? What did they say? The perceived susceptibility of infection and perceived severity. So that chart we're saying, like, how dangerous do you think it is and how easy do you think it is to get? Well, it turns out at the very beginning, everybody thought that it was really severe. It was really easy to get, and it killed people fast because it was so easy to get and it was so deadly. That was the thought. Turned out that wasn't true. So initially, everybody thought that the severity was initially high, but it declined early in the epidemic and remained thereafter. So it sounds very familiar. We're assuming this is Spanish flu, man. It's super, super easy to give to somebody else, and it's super deadly. It's very dangerous. This is the same thing everybody thought about H1N1. Not saying that this isn't any worse. Maybe this turns out to be a lot worse. I'm just saying historically, it's the trend that people think that. All right. After that, let's see, as the epidemic grew, knowledge of the models of transmission did not improve. So people didn't understand it any better. It wasn't because there's a big educational campaign. But the adoption of hygiene measures and the use of face masks did not change, and social distancing declined. So as it progressed, people didn't learn anymore, but over time kind of changed their behavior. So the conclusion was that the lack of substantial changes in preventive measures or knowledge about the models of H1N1 transmission in the general population suggests that the community mitigation measures, which are things like washing your hands and staying home and social distancing and wearing a mask, played little role in mitigating the impact of the first wave of 2009 H1N1 pandemic. So, in other words, they're saying we're not really sure it mattered that much. Also on PubMed, NIH, this was published in 2019 before the COVID, because the COVID has now adjusted the way people are communicating science. This is my point. There's no science behind everybody wearing a mask right now. So this is another story where they compared the actual surgical mask. So these are masks that have lots of things overlying. This isn't a woven fabric. Lots of fibers overlying each other to create very, very small pores. A surgical mask, something designed for this purpose, versus the N95 respirators, which is like creme de la creme, the best mask you can get, kind of. And they compared these in a non-biased way, or I mean, there's always bias, but less biased than would happen right now with the COVID. And this is why they were saying the people didn't need to be wearing these masks originally, because among the outpatient, this is not inpatient, we're not talking about people inside of the hospitals, among outpatient healthcare personnel, so healthcare providers who aren't in the ICU, N95 respirators versus medical masks as worn by participants in this trial resulted in no significant difference in the incidence of laboratory and confirmed influenza, meaning that whether you wore a surgical mask or an N95 mask, it didn't really change how many healthcare providers were infected. Now, these are people who are known to be exposed, and wearing the best mask and wearing a pretty darn good mask doesn't really seem to matter. So how could that be? Well, that could be because it wasn't nearly as communicable as we thought it was. Not nearly as many people got it as we thought would get it. So it could also mean that the masks both do nothing, or the masks both work fairly well. But let's talk about the science. So if we're basing policy, if we are basing your livelihood and my livelihood and the economics of the world and people's employment and people's joy in life and people's plans and visions of their futures and reasons to keep living, if we're impacting all of that, surely we're doing this for scientific methods. Surely there's strong evidence that says we need to do this. There isn't. I'm sorry. I'm not saying not to do it. I'm not saying flip your nose. In fact, I have a really fun way that we're going to play along with this game. And again, bad things are happening. If I were a healthcare worker in New York City right now, I wouldn't be given a second thought to wearing a mask all over the place. But we've had 300 people die, and slightly over 300 people die in Texas since this whole thing started. That's not very many people out of 30 million people. That is an insignificant number of people. We should not be changing the way everybody has to behave and scaring the hell out of everybody over 300 deaths. I realize it could get worse. People can look back on this in a year and laugh at me or whatever. I don't really care. I'm just saying that the important thing right now is to be rational and do evidence-based things. So let's talk about evidence-based stuff, okay? We're going to go back, get out of this screen share. So what I did a little bit of research. I talked about this in an earlier, no, I shouldn't say I did research. I did some reading of other people's research. And I went back and I did some reading, and what did I find? Well, I've talked about this earlier, and what I talked about was if you look at the actual, if you go to, actually engineering type data for N95 mask and surgical mask and what they filter out and all this other stuff, it turns out to be that they work reasonably well, but they don't filter out everything. And I'm about to tell you why they don't filter out everything. Because if they filtered out everything, you wouldn't be able to breathe, right? So these virus particles are very, 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 very small. How small? I'm glad you asked. Let me tell you. I came up with this metaphor. So I had to write it down because I don't remember where it's all right, so it goes like this. If you took a virus particle, all right, a COVID virus, which is 100 nanometers roughly, and you made that the size of 2 dimes stacked on top of each other, 2 dimes. And then you pick up a mask, so in my case, a bandana, and look at a bandana, and I can see little holes in there. There's light coming through it. Hold it up to sunlight, I can see light coming through, right? I can see little holes. All right, if I can see that hole, that means that the minimum size that hole is about the diameter of a human hair, because that's what my eyes can see. At my age, I probably couldn't even see that well, but let's just say I could. So that would be, what is it? It's a human hair is 0.1. It's 1/10 of a millimeter thick, all right? So if we made the virus 2 dimes, and I'm not talking about the whole dime, just on the edge of a dime, that's how big it would be. If you stood it up on the table, it would stand up to be 2 dimes. That's how small, that's how large we're making the virus. How big would the hole be? It would be 8 feet tall and 8 feet wide, the size of a small room, a pantry, maybe a small closet, 8 by 8. So if you're breathing out virus particles in your breath, how many dimes, if I said, let's just say a nickel is probably as thick as 2 dimes, how many nickels do you think you could get through that 8 by 8 hole? You're not doing anything with the mask, okay? I'm not saying that you should rebel and not wear a mask, because you'll get a fine. And if you don't pay the fine, you can go to jail. And that's a really stupid way to ruin things for yourself. For me, I have a license that's guided by federal and state government, so they could take away my medical license if I don't play the game. So not worth it to me. But and I'm not telling you this to say, don't wear a mask. I'm telling you this to decrease your anxiety and realize that this is a political, it's a policy, right? So it's a policy written by the government to make them feel good about something, or to do what they believe their constituents will make their constituents feel safer. It makes people feel safer if they feel like they can do something. There's nothing we can do. You're going to be exposed to this virus, period. You just are. There's no way around that. Unless this virus just dies off for some reason, not that they live, but if it just dissolves away, then you won't be exposed to it. But there's really no reason to expect that that's going to happen. Coronaviruses are all over the place. You have trillions of viruses in your body right now. Like, you're going to be exposed to this. That's just the way it works. We're trying to control how quickly that vulnerable people, the people who are susceptible to getting really sick, like, we're trying to slow down how many of those people get it all at once. So wear your mask in compliance with your local laws so that you don't get in trouble and make all of this worse. But just realize that this is something that is meant to make people feel safe. And there's zero scientific evidence for this. Absolutely big, definite zero. There's 0% evidence that this makes a difference to throw a bandana or something like that over your face. But it makes people feel better. It makes them feel like they're doing stuff. So I teased you a little bit. My response to this, I think it's moronic. I don't think it's moronic for every place. I think it's moronic currently for where I live, the population I live in, the medical resources we have, the population density we have, the incidence prevalence that we currently have. This is exceeding overkill in my mind. And if we're going to act like morons, let's have fun with it. So I'm going to wear my bandana, and I'm going to wear a big cowboy hat and a vest, and I'm going to dress up like a stagecoach robber. And I'm going to go through the store like that next time I go grocery shopping. And then I'm going to wear a leather jacket and a motorcycle helmet with the face shield down, because I've got my mask, I've got my face covered, and no one can say that I don't. And I also think I'm going to dress up like full-on surgeon and use all of my gear here and have a gown on and sterile gloves and the hat and the goggles and all of that stuff. And I'm gonna try to film these and take pictures of these. I thought of like if I could get some fighter pilot gear, maybe doing that, like the whole face mask and shield and all of that. Gas mask, maybe hazmat suit. Diving rig, you know, like a rebreather, you know, that has a face mask, like something like that. You know, let's just be idiots and have fun with all this. We'll treat it like Halloween, because it'll be the only fun thing that we can do right now is go out in the public and act like total idiots while being in compliance with the local laws and rules. That's all I'm going to say for today. I will I'll talk to my marketing team and see if we can do something to, you know, put it out on social media, have some competition videos, people take pictures of yourself, whatever. The good news is the serious cases are actually decreasing, and they're increasing at a decreasing rate, right? So we're adding very few serious and critical cases, which means with that delay that pretty soon very few people are going to be dying. There are currently still a lot of people dying. So again, I'm not being flippant. I'm not being dismissive. If this has impacted you personally, it has me. Like, I know people who have been very sick with this. I don't know anyone who's died. I have friends of friends that have died. So it is prevalent. It is happening. It is real. But let's put it in proportion to everything else. It is not by far the most likely thing that's going to kill you. You risk life every single day that you live. You get up and there's a chance you're going to die from something every single day of your life. So this 99.2% of all people, and that's gotten worse because when we first started this, it was like 99.7% of all people. But so 99.2% of all people, if we're being very liberal with who all died from coronavirus, 99.2% of all people did not die from coronavirus. So let's not start digging our graves just yet. Let's not, you know, keep in mind that of course there's going to be psychosocial, economic impact to what we're going through right now, but don't believe those doomsdayers either, right? Yes, there's going to be economic hardship. I mean, the experts don't know the future. The experts have been studying the past and they're making predictions, but nobody can predict the future. That's why it's called the future. Nobody can do it. Nobody can predict the weather. Nobody can predict the stock market. Nobody can predict anything. So if you'll notice, every single expert overestimated the number of deaths, right? The number of deaths started really big and it's coming down and coming down and coming down and coming down and coming down. As we get closer to reality, as we have more data to say what's really going on, the models get more liberal, more lenient. Academics, experts are risk averse. They are being hired to mitigate or reduce risk. So the economic experts are doing the same thing. They are going to predict doom and gloom. The social scientists are going to tell you how many divorces and battered spouses and suicides and all this other stuff are going to happen. And yes, I agree, bad stuff's going to happen, but it's not going to be as bad as everybody says. There's just no historic precedence for it. The experts are always going to be overly cautious. That's what they get paid to do. That's the lens with which they see the world. And that's why people hire them, to make sure that we don't make really bad mistakes and we didn't just all go, whatever, who cares? And, you know, maybe truly lose 1 million people. So that's the end of my rant for today. I hope that was helpful, and I will talk to y'all again soon.